Hi everyone. In one of my previous videos and many of my videos, I have talked about how a certain chemical group called the organophosphate pesticides, when they are present in our food or atmosphere, how they can impact our health. And like the organophosphate pesticides, there are many other chemicals that are used regularly and globally in farming practices. And the reason why I got involved in this field or talking about it, why I want to make this video, is because in the last few years, before COVID as well as after COVID, I had experienced multiple healthcare symptoms related to. First, it was very simple health symptoms that happened to me when I moved back to India from US. So after not having lived in India for a long time and only having briefly visited India during those phases, initially when I was getting some health symptoms, I just chalked it out to a difference between living in different countries. And as India is a tropical climate and US is not a tropical climate, I thought it was the tropical climate difference that was causing my health issues. But only after having lived here for a few years and going through and working through the health issues that I was facing, which were very minor at the initial stages, uh, I slowly started understanding what was going wrong, and it was like a step by step process. And this is also kind of like a ascension process that every human being on earth has to slowly wake up to as well regarding their health. If your health is currently at a stage where you have some minor health issues or even some moderate level physical health issues that are cropping up, for which you are taking, as most of us are bound to do, we would be taking medications recommended by a doctor, doing some home remedies, doing both. And most of us think that whatever has been tried and tested by the doctors, tried and tested by our mothers, they are safe practices to do, which would have been true even a few years back if our earth was cleaner and stayed cleaner in most parts of the world. But unfortunately, because of heightened chemical usages in farming, in our regular daily life, Earth's water systems have got polluted greatly. And not just water system, Earth's air is also polluted. Our fields are also polluted, which in the end results in crops and trees from failing to produce the crops or fruits that humans survive on. As a result, I'm making this video because there are multiple things that I actually want to address, and I'm feeling a little tired today because I'm feeling the change in the atmosphere in the place where I'm living. It is impacting my health. It has been impacting my health consistently for a long time. And if we don't take the right measures to change earth pollution paradigms, most of us are going to fall sick in some way or the other, and most of us are currently sick as well. We just don't know our health status. This is essentially also one of the reasons why COVID happened, because those people whose physical health had gone to a really severe health crisis level as a result of earth pollution related parameters, they might not have understood it themselves. Their doctors may not have understood how severely ill they were getting. But even if they didn't understand it, their doctors didn't understand it, their caregivers didn't understand it, their family didn't understand it, their social group didn't understand it, doesn't mean that they weren't sick. That's why, if you are living in a colony or a society or a city where thousands of human beings are coexisting with you, or you even live in a village, nowadays, even villages have at least thousands of people living in a village. So, when there are so many people existing in the same area, they all have been exposed to the coronavirus because it's a virus, it's present in the air. In order to minimize the exposure to the virus, we were wearing masks. But even then, when we are eating, drinking, taking a shower, we were not wearing masks and we could have inhaled the virus. The virus could have been present on any of our food also that we were eating. So we could have consumed it also. We could have consumed it and inhaled it and got exposed to it from multiple sources. But despite the exposure from multiple sources, out of a group of 1,000 people, maybe only 10, 20, 30, 50 people fell really, really sick and were hospitalized. And of them, many of them died. But there were also many who were only minorly or moderately impacted by COVID. And this difference of those who got really sick versus those who got only moderately sick, and then there were those who managed their sickness without going to the doctor because not enough doctors were available in their city to treat them, or not enough hospital beds were available for them to go and occupy a hospital bed. So many interventions were in play, not just what the government regulation and hospital systems of that country was propagating as an intervention. And these other interventions were important during the COVID crisis to help us have a good quality health, because that is how health works. Medicines can help us in alleviating or stopping or reducing some of the severe symptoms of a disease or moderate symptoms of a disease that result in some organ systems not functioning or cause us to feel extreme inflammation, pain, body aches, headaches. These were some of the COVID symptoms, right? Some people got skin allergies and their feet were irritated. Some people had respiratory problems, some had cardiac problems, some had a multiple set of problems. And depending on the set of problems of your body, when you were hospitalized, the doctor was trying to treat the symptoms related to the how the virus had impacted your health. But there was a secondary thing going on behind COVID, which most of humanity has not yet awakened to, but it is something people have to awaken to if they want to stay healthy long term. Because even though many of us have been vaccinated, or most of the world has been vaccinated currently, despite that, there are so many people in studies have been done in cities and countries where, despite even over 90% vaccination rate, those cities faced repeat COVID incidences after the vaccinations. Or despite most of us having got vaccinations, there are people who are getting something called long COVID, which is essentially those symptoms of body aches and pains, headaches, flu-like symptoms, whatever symptoms you had experienced before you got hospitalized or before you were diagnosed with COVID. Those symptoms are continuing in their life even after they got treated for COVID, and their blood is showing that they do not have the viral infection anymore. Despite that, how is it that some people are still experiencing this long COVID symptom? Because though doctors have currently and scientists have currently correlated the 5, 10, 20 symptoms that they have found to be the common symptoms present in majority of the COVID patients, it is not necessary that the body aches and pains and headaches and flu-like symptoms, or even respiratory distress or cardiac symptoms or skin allergies that people were experiencing during COVID was actually because of the virus. because when you have multiple things going wrong in your body, that is the only time when people fall seriously sick. Need to get hospitalized, they need severe urgent care treatment from doctors or medical providers. And in those moments, while when the COVID crisis was going on, people were so focused on just helping people get better. People didn't analyze the data carefully, didn't pierce out the data that is existing already from the months and years of COVID related research, as well as research related to other mutations of flu viruses that were present before COVID. Because all of this data is important to understand how COVID actually worked on in our health. And the second thing is, because of earth pollution, because our food has got polluted, our air has got polluted, our water is polluted currently from multiple chemical usages from multiple sources, and as a result our clothes also gets polluted, our homes also get polluted. All these pollution parameters from environmental toxins are also impacting people's health. So this is a secondary thing that is going on in the background of all long COVID patients. So if you're a long COVID patient, this is the guidance I have got from the universe. This is a thing I have studied a little bit carefully because I was a former scientific researcher as well as a pharmacist earlier. So when I look and reflect deeply on the data on COVID, and I have only looked at the superficial data and the natural body's data, and also my own personal experiences as a person who's suffering from many symptoms that mimic COVID, though when I did get tested for COVID, I didn't have it at that time. So what was happening with me at that time, I realized, was my body was going into high levels of inflammation. I had cytokine storm, the same cytokine storm that a COVID patient also gets. I had skin irritation and allergies. I had respiratory distress. I had cardiac health problems. I also had some liver enzyme levels showing up high. I also had some kidney function related parameters showing up differently than the norm in my blood reports, and I had heightened inflammation. I was near cancer levels. But what was the root source of this near cancer level that I went through, and all these multiple range of symptoms that I'm talking about? And these symptoms didn't develop in one day, 1 month, 1 year. It developed over a lifetime of exposures to different chemicals, different things that have consumed in food, water, air, and not just simply my lifestyle in India impacted it, but I had lived 13 years in US. Those 13 years also played a role in impacting my overall health trajectory. And this is the same thing that is true of any human being on earth. If you live in only one city and you have lived in that one city for decades of your life, everything you have done in your life since your birth, or in fact even before your birth, because everything your parents did before you were born, all of those genetic factors could be impacting your health. Whatever nutrition they had when your mom was carrying you, that could be impacting your even present health. Whatever food you have consumed, food, water, air, environmental toxins you have consumed since your birth on this earth, all of them are impacting your health. And it doesn't matter if you've lived in one city, one town, one village for decades of your life, or you have been a traveler like me who has traveled to multiple destinations, lived in 2 different countries. It doesn't matter if you are a global traveler or you are a non-traveler who has only maybe lived in 1 or 2 cities or a village and a city. It doesn't matter. But what does matter? It doesn't matter and it does matter. There are 2 things in play here. What doesn't matter is that if same kind of earth pollution is happening in every city, village, town, country of the world, same kind of health repercussions will happen to them, and which is what essentially happened during COVID. Those patients who got severely hospitalized, if people will dig deeper into their healthcare data, they will find out some commonalities in the symptoms, and that's how the COVID symptoms came up. The COVID guidelines came up that if you have these symptoms, then you should go to the doctor or see a doctor, or all the information of COVID comes out like that, when everyone globally or many people globally are having manifesting certain same symptoms. But these same symptoms that have been allocated to COVID, if it is continuing even when the virus is not there in your body via the tests that you are doing, what does it mean then? Even if you have the symptoms pre-COVID and post-COVID, then doesn't it mean that there is something going on in your life, in your lifestyle, that is actually impacting those body aches and pains, headaches, and whatever other neck pain, skin irritation, scalp infection, whatever organ damage, whatever else is continuing to happen in your body as a result, even after COVID has gone away from your body, means that COVID was only part of the reason why you got all these symptoms, and that there are other factors present in your life which is impacting your health. And these other factors, for again majority of us globally, is the environmental toxin in the lifestyle we lead. Now these environmental toxins, I spoke about pesticides previously and organophosphate pesticides in some of my previous videos. I also spoke about mosquito repellent sprays also in my previous videos. But there are many other groups of toxins that are continuously used by all of us globally. And they are all normalized practices that humans have been doing for at least 50 to 70 to 80, 90 years of our life on earth. Some of them are new recent practices that might have started in the last 5-10 years, but majority of the things that humans like me do in our lifestyle, or anyone who is in their elderly age phase does in their lifestyle, are practices we have learned since childhood days, and we have most of the time continued with some similar practices that our parents taught us, and we have introduced some additional practices that we were taught while we became young adults and explored our life as adults. As a result, say if our parents, when we were growing up, a simple example of earth pollution enhancing parameter that none of us considers as a factor in earth pollution is the use of soaps and detergents and shampoos for our cleanliness and hygiene. Now, we all need soaps and detergents and shampoos for washing our body, washing our clothes, washing our other kinds of chemicals are used for cleaning our homes,